You may have concerns about using CBD oil and the effect that it could have on a drugs test. Many users of CBD oil have the same concern, but the good news is we can help to ease your mind. Many of those who use CBD oils do so because they suffer from anxiety, insomnia, stress, pain, or many other conditions. Some users may be athletes, some may be federal employees, and some may work 9 to 5, whereas others may use CBD oil as their current prescription medication is not working as well as they may like. Whoever you are and whatever you do, you need to perform at your very best. Whether you work for the government, you're an athlete, or you work elsewhere, your employer may routinely carry out drugs tests. What exactly are drug tests? Drugs tests analyze your urine, sweat, hair, saliva, or blood to check for prescription medication or illegal drugs. One of the most common drugs tests is urine drug testing, and there are two types of urine drug testing, UDT, which include a screening test and then a confirmatory test. The screening test works by using a biological test known as an immunoassay. This is a test that uses antibodies to detect the drug. If the screening test shows up positive, then another test will be carried out. This second test involves using a GC/MS, gas-chromatography and mass spectrometry, test. The GC/MS test uses a specific technique that may or may not confirm that a specific drug has been detected. What do drug tests show? While some people think that drug tests show how impaired they may be as a result of using a drug, they actually show past drug use. However, whether drug use shows up in your tests entirely depends on what drug was used, how much was taken, and how often the drug was taken. You should be aware that some drugs may be found in your system weeks after you have used them, whereas others may be detectable for just a few hours. When will you be drug tested? This ultimately depends on where you work and where you live. You may be asked to take a drugs test before you are offered a job, or you may be asked to take one from time to time. Some people have to take an alcohol test, depending on their state's law. Every competitive athlete has to take a drugs test so that they can be tested for a range of prohibited substances. However, it's not just professional athletes who are tested. Amateur and collegiate athletic organizations may also want people to take drugs tests too. This is to make sure that performance-enhancing and recreational drugs are not being used. Drugs tests can also be used as part of parole or probation requirements along with substance abuse issues. What substances do drug tests look for? While we would like to be able to tell you exactly what substances drug tests look for, there is no way to say what they are. This is because different drug tests look for different drugs. The drugs in question will depend on who is administering the drug tests. Some companies and organizations look for marijuana, whereas others may look for cocaine, methamphetamine, alcohol, opioids, barbiturates, cocaine, or a combination of drugs. It all depends on what the organization or company is most concerned about. What we do know is that most drug tests screen for marijuana, and in doing so they look for tetrahydrocannabinol, THC, which is a psychoactive compound associated with marijuana. THC is routinely searched for as it causes the user to feel high. This is because the THC binds with a receptor in the brain that gives the user that feeling of euphoria. CBD oil and drug tests. The good news is that CBD oil tends to only have trace amounts of THC, which means it will not result in a positive drug test, in most cases at least. If you stick to the recommended doses of CBD oil, then any drug test that you take should be passed with flying colors. This is because most drug tests are unable to detect cannabidiol. However, if you take more than the recommended dose, you may not pass the drug test, which is why you should always stick to the recommended dose. The other piece of good news is that if you have taken a high dose of CBD oil and you do not pass the first test, the GC/MS test should not be an issue. As we previously mentioned, the GC/MS test uses a specific technique that looks for a certain drug, and it's very rare that CBD will be detected in this test. CBD does not cause its users to feel high. This is because it's a non-psychoactive compound. Urine drug tests for THC shows little cross-reactivity to cannabinoids that aren't psychoactive. This means that as long as you stick to the recommended doses of CBD oil, you should pass the drug test. However, you should be aware that if you use CBD oils, you should perhaps refrain from eating foods that contain hemp. This is because the combination could cause blood and urine tests to show up positive, although this is quite rare. If you are worried about using CBD oil and taking any kind of drug test, you should refrain from taking CBD oil until you have spoken to your doctor.